Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, we are from the second group, and here in this opportunity we are going to tell you materials about anatomical body. Actually, this materials consists of 4 points. For the first one is position, the second one is movement, and the third one is action, and the last one is direction. Okay, please take a look at the materials.
Hello, my name is DEVI MURNIAWATI. Here I would like to explain about anatomical position. Okay, start from the definition. Standard anatomical position is a way of describing the anatomy of an organism so that it is easy to understand what part of the body is being talked about, no matter what direction the organism is facing or where its appendage or limbs are, and have the function of standard anatomical positions. In human, standard anatomical position is with the body standing up, straight and facing forward, with arms by the sides of the body and palm facing forward. The legs are straight and the feet are slightly apart from one another and turned outward slightly. This is used as a starting point for describing the body. Standard anatomical position is with all 4 feet on the ground so that the belly of the animal is roughly parallel with the ground. Let's take a more detailed look at the labels used for different parts of the anatomy. They are regarded as axes because they are used to describe how near or far a body part is from an end of the organism. The first one is superior anterior. Come from the Latin words meaning above and up, below. In standard anatomical position, the head is the most superior part of the body and the feet are the most interior. Second is medial lateral. Lateral is the parts of the body are toward the sides. Medial is the middle of the body. If a part of the body is lateral, it can mean left lateral or right lateral. In standard anatomical position, a person's right hand is on the viewer's left, since they are facing opposite the viewer. The third is dorsal ventral. The dorsal side is the back side of an organism. The ventral side is the belly side of an organism. The fourth is cranial caudal. Cranial refers to being closer to the head. Caudal refers to being closer to the tail. The terms dorsal and caudal are used when referring to the skull, while the area toward where the spine attaches is caudal. 5 is proximal distal. Proximal part of a limb is the part close to where it joins the body. The distal part is the part farthest away. For example, the tips of our fingers are most distal part of our arms. And the last is planes of the body. They are sagittal plane, coronal plane, and transverse plane. I would like to explain one by one to start from sagittal plane. Sagittal plane runs down the center of the body and divides the body into left and right sides. Second is coronal plane. Coronal plane divides the body into dorsal and ventral sides. And the last is transverse plane. Transverse plane at the waist and runs parallel to the ground, dividing the body into cranial and caudal sections.
Hello, my name is IZZATUL ANWARIYAH, and here I want to present the explanation about movement, planes, and axis. Anatomical terms of movement are used to describe the action of muscle upon the skeleton. Muscle contract to produce movement at joints, and the subsequent movement can be precisely described using this terminology. The term used assumes that the body begins in the anatomical position. Most movements have an opposite movement, also known as an antagonistic movement. We have described the term in antagonistic pairs for ease of understanding. We explore the difference between an axis, a plane, and a plane before describing different joint movement in the context of the larger joint in the body. Planes. There are several different planes that we use to describe the body and movements. There are three major planes. The first is sagittal plane, to divide the body into the left and the right halves. Median plane is referred to the midline. Paramedian planes refers to subdividing one half. Example, flexion and extension of the hip occurs in the sagittal plane. Coronal planes is to divide the body into anterior and posterior halves. Example, the abduction and adduction of the shoulders occurs in the coronal plane. The third is transverse or axial plane, is to divide the body into superior and inferior halves. Example, left and right rotation of the thoracial joint occurs into the transverse plane. Axis. There are also several different axes we use to describe the movement of a joint. It is useful to think of an axis as a metal pole, and the joint rotating around this pole. First one, sagittal axis, passes horizontally from anterior to posterior, formed by the intersection of the sagittal and transverse plane. Example, the abduction and the adduction of the shoulder about the sagittal axis. The second is coronal axis, passes horizontally from the left to the right, formed by the intersection of the coronal and transverse planes. Example, flexion and extension of the hips occur about the coronal axis. The third, vertical axis, passes vertically from superior to inferior, formed by the intersection of the sagittal and coronal flames. Example, left and right rotation of the anteroaxial joint occurs about the vertical axis.
I'm IZMI ADAWIYAH. In here, I will continue to explain about anatomical terms of movement. And the next is flexion and extension. Flexion and extension are movements that occur in the sagittal plane. They refer to increasing and decreasing the angle between the two body parts. Flexion refers to a movement that decreases the angle between two body parts. Flexion at the elbow is decreasing the angle between the ulna and the humerus. When the knee flexes, the ankle moves closer to the buttocks, and the angle between the femur and tibia gets smaller. And extension refers to movement that increases the angle between two body parts. Extension at the elbow is increasing the angle between the ulna and the humerus. Extension of the knee straightens the lower limb. And then there are abduction and adduction. Abduction and adduction are two terms that are used to describe movement towards or away from the midline of the body. Abduction is a movement away from the midline. Just as abduction, someone is to take them away. For example, abduction of the shoulder raises the arms out the side of the body. Abduction is a movement towards the midline. And next, medial and lateral rotation. Medial and lateral rotation describe movement of the limbs around their long axis. Medial rotation is a rotational movement towards the midline. It is sometimes referred to as internal rotation. To understand this, we have two scenarios to imagine. Firstly, with a straight leg, rotate it to point the toes inward. This is medial rotation of the hip. Secondly, imagine you are carrying a tea tray in front of you with the elbow at 90 degrees. Now, rotate the arms, bringing your hand toward your opposite hip or elbow still at 90 degrees. This is internal rotation of the shoulder. Lateral rotation is a rotating movement away from the midline. This is the opposite direction the movement described above. And next, elevation and depression. Elevation refers to movement in a superior direction, for example, shoulder shrug. Depression refers to movement in an inferior direction. Elevation refers to lifting and depression to the lowering. These movements only occur in several regions of the body and are the result of movement along of the coronal plane. Example of elevation. The first, elevating the shoulders to shrug, and the second, elevating the mandible during mastication to close the mouth. And then, example of depression. The first, returning the shoulders to resting anatomical position after shrugging. And the next, pronation and supination. This is easily confused with medial and lateral rotation, but the difference is subtle with your hand resting on a table in front of you and keeping your shoulder and elbow still. Turn your hand onto its back, palm up. This is supine position, and so this movement is supination. Again, keeping the elbow and shoulder still. Flip your hand onto its front, palm down. This is the prone position, and so this movement is named pronation. These terms also apply to the whole body. When lying flat on the back, the body is supine. When lying flat on the front, the body is prone.
Hi everyone, I am Asti Putri. Here, I will continue the discussion about the part of movement, namely dorsiflexion and plantar flexion. Dorsiflexion and plantar flexion are terms used to describe movement at the ankle. They refer to the two surfaces of the foot, the dorsum, superior surface, and the plantar surface, the sole. Dorsiflexion refers to flexion at the ankle, so that the foot points more superiorly. Dorsiflexion of the hand of a confusing term, and so is rarely used. The dorsum of the hand is the posterior surface, and so movement in that direction is extension. Therefore, we can see that dorsiflexion of the wrist is the same as extension. And next, plantar flexion refers extension at the ankle, so that the foot points inferiority. Similarly, there is a term for the hand, which is palmar flexion. Okay, next there is inversion and eversion. Inversion and eversion are movements which occur at the ankle joint, referring to the rotation of the foot around its long axis. Inversion involves the movement of the sole toward the median plane, so that the sole faces in the medial direction. Eversion involves the movement of the sole away from the median plane, so that the sole faces in a lateral direction. Okay, next there is opposition and reposition. Opposition and reposition are special movements unique to the human hand. They are movements that allow us find dexterity to hold objects. Opposition and reposition
at the thumb and little finger, digits 1 and 5 respectively. They even have their own separate muscle for this movement. Opposition of the thumb and little finger refers to the movement of bringing the pads of the thumb and little finger together in the midline of the hand. Technically, the thumb can be opposed to each of the other finger on the same hand. Reposition refers to returning the thumb and little or one of the others finger back to resting anatomical position. And next there is circumduction. Circumduction can be defined as a conical movement or a line extending from the joint at which the movement is controlled. It is sometimes talked about as a circular rotation, but it's more accurately conical due to the cone formed by the moving limb. Okay, and the next is there is protection and reaction. Protection describes the anterolateral movement of the scapula on the thoracic wall that allow the shoulder to move anteriorly. In practice, this is the movement of reaching out to something. Reaction refers to the posteromedial movement of the scapula on the thoracic wall, which causes the shoulder region to move posteriorly, i.e. picking something up. Maybe this my explanation.
Hello, my name is Rindu Ayuni Fujiastuti, and here in this opportunity, I would like to deliver materials to you about Anatomical Body of Actions. Okay, let's move to the materials. There are over 600 muscles in the human body. Learning the muscular system often involves memorizing details about each muscle, like where muscles attach to bones and how muscles help move a joint. In textbook and lectures, these details about muscles are described using specialized vocabulary that is hard to understand. And what does all that textbook jargon mean? The triceps brachii has 4 places where it attaches to the scapula, humerus, and ulna. These muscles plays a big role in extending the elbow joint from a bend to a straight position, like this. For the first elements of the muscle itself is muscles attached to a location called origin and insertion. Skeletal muscles attached to bone or sometimes other muscles or tissues at 2 or more places. If the place is a bone that remains immobile for an action, the attachment is called an origin. Here is an origin. If the place is on the bone that moves during the action, the attachment is called an insertion. This one. This is origin, this is insertion. The triceps brachii happens to have 4 points of attachment, one insertion on the ulna, and 3 origins, 2 on the humerus and 1 on the scapula. And then the second one is muscles act on synovial joints to move the body. The muscles surrounding synovial joints are responsible for moving the body in space. These muscles' actions are often paired, like flexion and extension or abduction and adduction. For the first one is flexion and extension. Flexion and extension are usually movements forward and backward from the body, such as nodding the head. And this one is extension. It means that increasing the angle between two bones or straightening a band. And this one is flexion. It means that decreasing the angle between two bones or bending. And then the next one is abduction and adduction. Abduction and adduction are usually side-to-side movements, such as moving the arm laterally when doing jumping jacks. And this one is abduction, which means that moving away from the body's midline. And this one is adduction, which means that moving toward the body's midline. And then the next one is pronation and supination. Describing the rotation of the forearm back and forth requires special term. Spread your finger out and look at the palm of your hands at the fingers, and then rotate your palms to look at your nail. That's forearm supination and pronation. This is pronation. It means that rotating the forearm so the palm is facing backward or down. And this one is supination. That means rotating the forearm so the palm is facing forward or up. This one is pronation. This one is supination. And then the next one is elevation and depression. Elevation and depression are up and down movements, such as chewing food. When you move the mandible down to open the mouth, like this, that's mandible depression. And when you move the mandible back up, like this, from here to here, that's mandible elevation. For the example is elevation, like this. It means that moving a body part up, while the depression is like this. It means that moving a body part down. And then the next one is protraction and retraction. It is by moving your jaw back and forth in a jutting motion. You are protraction and retracting your mandible. This one is protraction. Please look at me. It means that moving a bone forward without changing the angle, like this. And then this one is retraction. It is moving a bone backward without changing the angle, from this to this. And then the next one is inversion and eversion. Actually, it happens on your foot because you invert your foot when you turn it inward to see what is stuck under your shoe, and you invert your foot to put the sole of your shoe back on the floor. Let's pretend that this is a foot. Pretend it. And when your foot like this, it's kind of inversion. And when you are doing your foot like this, such as before, to the normal position, it is eversion. And then the next one is dorsiflexion and plantar flexion. It is actually happens on your foot, and You dorsiflex your feet to walk on your heels and plantarflex them to the tip toe. Let's pretend that my hand is a foot, like this. When you do your foot like this, when you wear a high heel, you are doing a dorsiflexion. It means that bringing your foot upward toward your shin. And when you are doing like this, to the normal position, it is plantar flexions. It means that replacing your foot. And then here are the third elements of muscles. Muscles actions have primes mover, synergies, stabilizers, and antagonists. What is that about? Let's check it out. While many muscles may be involved in any given actions, muscles function terminology allows you to quickly understand the various roles different muscles play in each movement. For the first one is prime movers and antagonists. The prime mover, sometimes called the agonist, it is the muscles that provides the primary force driving actions. An antagonist muscle is in opposition to a prime mover in that it provides some resistance and or reverses a given movement. Prime movers and antagonists are often paired up and on opposite sides of a joint with their prime mover or antagonist roles reversing as the movement changes direction. And then the second one is synergies. One or more synergies are often involved in an action. Synergies are muscles that assist the prime mover in its roles. And then the last point is stabilizer. Stabilizer acts to keep bones immobile when needed. Your back muscles, for example, are stabilizer when they are keeping your posture steady. I think that's all from the anatomical body of action. Let's move to the next materials.
I am TITA TRISNAWATI. Here, I want to present a material about anatomical orientation and directions. To be able to direct others to specific anatomical structures or to find structures based on someone else's directions. It is useful to have specific pairs of terms that allow you to orient your search with respect to the location of another known structures. The following pairs of terms are used to make comparisons. Each term is used to orient a first structure or feature with respect to the position of a second structure or feature. The first, superior or inferior, equivalent to above and below when moving along the axis of a body in anatomical position. The structure that is superior to another is above the second structure when the body is in anatomical position. A feature that is inferior to another is below to second feature when the body is in anatomical position. The second, proximal or distal, equivalent to near and far, usually used to orient the position of structures and features along the lines with respect to the trunk of the body. A feature that is proximal to something else is closer to the line's point of attachment to the trunk. A structure that is distal to something else is farther away from the line's point of attachment. less precisely but still occasionally used in the trunk of the body itself to indicate whether something is closer to proximal or farther away from distal something else. The third, medial or lateral, equivalent to toward the middle or toward the edge, used with respect to the midline of the trunk of a body in anatomical position. A structure that medial to another is closer to midline of the body's trunk. A feature that is lateral to another is farther away from the midline of the trunk. 4. Anterior or posterior, equivalent to the front and back of a body in anatomical position. A structure that is anterior to another is closer to the front of the body when the body is in anatomical position. A feature that is posterior to another is closer to the back of the body when the body is in anatomical position. 5. Ventral or dorsal, equivalent to belly side and back side of a body in anatomical position. For a human in anatomical position, this pair of terms is equivalent to anterior and posterior. However, for fossilized animal in what is considered their anatomical position, the belly side is not equivalent to the front of the animal. A structure that is ventral to another is closer the belly side of the body. A feature that is dorsal to another is closer to the back of the body. 6. Superficial oblique, equivalent to closer to the surface and farther from the surface. And the last, cephalic or caudal, equivalent to closer to the head and closer to the tail. This is more useful for four-legged animals with tails than for upright humans with only vestigial tails.
Yay! Finally, we are here at the end of the video, and I think it's time for saying goodbye to all of you guys. Thank you for watching this video, and I hope these materials presented by us can be useful for you. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.